Clinical features in subacute thyroiditis. Clinical manifestations. In an analysis of 94 patients with subacute thyroiditis, pain was a presenting symptom in 96%. The onset may be sudden or gradual and may be preceded by an upper respiratory infection. The pain may be limited to the region of the thyroid or radiate to the upper neck, jaw, throat, upper chest or ears. Pain can be exacerbated by coughing or turning the head. As a result, some patients first consult an otolaryngologist. Fever, fatigue, malaise, anorexia and myalgia are common. The thyroid gland is typically slightly or moderately diffusely or asymmetrically enlarged and nearly always tender. In some cases, the pain is so severe that the patient cannot tolerate palpation of the neck. Both thyroid lobes are involved from the beginning in most patients, but the pain, tenderness, and enlargement can be unilateral or start on one side and later spread to the other side days or even weeks, so-called creeping thyroiditis later. Approximately one half of patients have symptoms and signs of hyperthyroidism, but the neck pain and tenderness usually dominate the illness, and the diagnosis should not routinely be made in their absence. Temperature elevations also can occur. The thyroid inflammation and hyperthyroidism are transient, usually subsiding in 2 to 8 weeks, even if the patient is not treated. It may be followed by a period of transient, usually asymptomatic hypothyroidism lasting from 2 to 8 weeks or longer, but recovery is nearly always complete in the short term. In a follow-up study of 160 patients with subacute thyroiditis seen at the Mayo Clinic, 15% of patients eventually developed permanent hypothyroidism requiring levothyroxine therapy. Only 4% of the patients had a recurrence. Although the hyperthyroidism is usually mild and transient, it may rarely be associated with serious side effects such as ventricular tachycardia and thyroid storm.